My name is Brian McLaughlin. This is Ray Kia and Indian Williamson. We're all from USI Affinity and my benefit advisor. Just want to welcome you. Thank you very much for coming. Presentation, this is the second one we did today. First one took about an hour. So please join this presentation. Pretty small group here. Ask us any questions, stop us if there's something that you want to discuss a little bit further. We're going to spend most of the time talking about kind of my benefit advisor, how it's helping firms save money, build better employee benefit programs, do a little bit about kind of the overall marketplace and kind of where we see health insurance going over the next year, next couple of years. All right. So my benefit advisor is a program that Montgomery Bar Association offers to its members. We're actually part of USI Affinity, so same group that many of you probably have worked with over the years and maybe still working with. Just due to ACA and some of the things that have gone on with healthcare reform, we've kind of reinvested in our brand and our product and are really here to almost reintroduce ourselves and the offering that we offer to members of the Montgomery Bar Association. Going through here and what we're going to talk about today, kind of summarize on this slide, there's really four things. We talk about our consulting and how do we help you meet your budget, right? Whether you're a sole proprietor or you're 100 attorneys, right? Well, how do we help you build the program that you need to successfully offer your benefits program? Second piece is the enrollment and communication. So for those of you who have employees, how do we help educate those employees on the benefit program? All right, you spend so much money as employee benefits. It's probably second to payroll, right? Your biggest expense. Communicating it to the employees and selling the employees on the benefits or helping them access that is a huge part of the solution. Management piece is how do we take care of the everyday administration, the other days of the year that we're not talking about the renewal. So as the weeks turns, overall, communications, taking care of the management of the program, and then last and sometimes the most important piece is the compliance piece. So how do we help and what are the things that you need to kind of worry about as far as either state legislation, federal legislation, or rules. We spend a lot of time on ERISA, which is 40-some years old now. And people are still trying to comply with that. So that's what we're going to talk about today. Again, if there's anything that you'd like us to get into as well, just stop me as we're going through the presentation. So just a quick kind of review of our organization. USI Affinity is part of USI. USI is a top 10, the way they count it in 2017, is probably about the 5th or 6th largest broker in the country at this point in time. I've been with the company for 16 years, working with Montgomery Bar Association for most of those. Ray's been with the company for 24 years. And in that time, we've changed pretty dramatically. I think there were less than 1,000 employees when we started. We're about 7,500 employees right now. Just recently purchased Wells Fargo Insurance Services, Key Bank, Beneficial actually has closed early part of this week. So significant growth both from an organic perspective, but also through acquisition. What does that really mean to you in the room? Is that just more resources that we're able to bring kind of downstream. And again, the solution that we offer being for the Bar Association's My Benefit Advisor platform. My Benefit Advisor is our division's about 300, and the employees dedicated to the My Benefit Advisor platform is about 65 employees. Of those in our local office, we have 10 account managers, 3 account coordinators, a full customer service team, supported by marketing, implementation, consolidated billing, and administrative support. I bring this up early part of the presentation because, quite frankly, brokers of our size and our expertise really have moved up market. Really are looking for 100, 200 employees and above. But we're still playing in the association space, working for everything from individual attorneys through about 300 employers, but probably our sweet spot is in that kind of 20 to 200. So on the consulting side, first things first is that, if you were to participate with My Benefit Advisor, just give you a little bit of an idea of what your team looks like. So everyone that partners with My Benefit Advisor, and specifically in firms with 10 plus would get a team like this. So an account executive, someone such as Ray, who's there for part of the sales process and then stays with the account year in and year out. Second, you're assigned a dedicated account manager who's strictly on the retention side, meaning that they have no sales responsibility. Their job is only to work with in-force customers, and they really become the quarterback of everything else that we're going to talk about the rest of the day. Implementation specialists, so when we talk about communications, we talk about technology. They're the ones that are really behind the scenes, building all that out for our customers. Benefit counsel, we have over 15 ERISA attorneys around the country that we have access to, which means they all have different specialties. So as they do things in Washington or don't do things in Washington, we're able to kind of boil that down and bring it to our clients, kind of bite-sized pieces, make it a little bit easier for you to kind of stay in compliance. Ancillary advisories, this is for all the non-medical products, right? And so dental, life, disability insurance. We have a full team that focuses strictly on that. It's not as big a line item as medical insurance is concerned, but it is one of those areas where, you know, our size and our scope actually enables us to get better pricing, right? Like I can't make a Blue Cross PPO Gold plan for a group of 5. I can't change that particular price. One of the dental, life, and disability, we can have a pretty significant advantage because we are one of the largest distributors for, you know, most of the ancillary carriers. So certainly something there, and then we'll talk about this throughout the rest of the process, but you know, all of our customers get access to our call center or benefit service center. These are all licensed individuals. It's all recorded, and it's all right here, right? We're right here in Blue Bell. We're not offshoring it. We're not, you know, using a call center in Iowa or anything like that. They're local people that are dealing with the carriers that you have day in and day out. So it's a great team that when we put this all together really provides a solution that's pretty unique to members of the Montgomery Bar Association. So let's just talk about plans and some more, I'll say, high-level overview of where we see things going as far as carriers and different solutions that we're rolling out for our customers today and where we really see the renewal going for 2019. So first, I'll just start with the quote-unquote fully insured carriers, right? So this is your more traditional insurances that many of you may be on. In the small group market, in the individual market, it's just Blue Cross. But in the small group market, which would be anyone with at least 2 employees through 50 employees, there's 2 fully insured options today. It's Independence Blue Cross and United Healthcare. All right? So for 2019, we are expecting probably the best renewals that we've seen, right, in maybe 10 or 15 years. Average increase, we won't have it for 2 weeks, but we're expecting the average increase to be about 4 or 5%. And I know, you know, not all of you are going to be able to raise your prices 4 or 5% next year, and you know, we'd love to see them go down or at least stay steady. But you know, after increases that averaged about 15% in 2018, to get down to kind of that low single digits is, you know, a good thing. So, you know, a couple of reasons for that. You know, one, we've seen that there's a tax that's worth about 4% that's a part of healthcare reform that wasn't in there in 16 and 17, was put into the rates for 2018 and gets taken back out for 2019. So, you know, last year's increases that we said were in that 15-16% range, you know, really should have been 10 or 11, but then we added the 4% on. Now this year, we get to take that 4% off, plus experience has been a little bit better from a Blue Cross perspective. United Healthcare is the other player in that kind of ACA age-banded space. United Healthcare is actually in the process of rolling out an HMO. I kind of joked, like I feel like it's like the late 90s, like, oh, new concept, an HMO. But United Healthcare never had an HMO in this marketplace. United Healthcare in 2018 is very, very competitive in the small group market, and what I would say is like kind of the top end of the market. What I mean by that is you kind of have platinum plans and gold plans and then silver, bronze. They kind of go from top to bottom from a benefit and price perspective. United Healthcare is very competitive in the platinum and the gold plans, but Blue Cross was much more competitive in the silver and the bronze. and especially in anything that was managed care. So United Healthcare is rolling these HMO programs out, managed care programs out for January 1st, expecting to lower their price point about 10%. So we'll know over the next 2 to 3 weeks how that compares against the Blue Cross plans, right? The other thing that we're seeing a lot of people in that kind of small group, fully insured world, specifically on the Blue Cross side, the other product that we need to make sure people are aware of is that within Blue Cross, and nothing's really changing from what we can tell from 2018 to 2019, so no dramatic changes to the benefits. But one thing that we're talking to a lot of clients about are the proactive programs through Blue Cross. If you need to find kind of the best price point and the lowest price point, the proactive HMO programs through Blue Cross are really helping people get to the price points that they need. Now, it's a big issue, and we oftentimes see this as strictly an option for firms, right? Not for everybody to be in this plan. But the issue with the proactive is it's the tiered network, right? So it's not the full network. You have tiers on those networks, so tier 1, tier 2, tier 3, and it's trying to drive you to the tier 1 with lower copays. The tier 3 hospitals are going to be the ones that you could probably guess off the top of your head. It's Penn, it's Jeff, it's Mainline Health, right? And so the proactive series is going to cost you significantly more money if you go to those hospitals, but if you're using hospitals outside of those health systems, you can see some pretty significant savings. Right? So certainly something that we're talking to employers about in that space. The other thing that we're really spending, and I'm going to spend just a short amount of time, maybe 5-10 minutes on these other concepts. So outside of those fully insured plans, we're starting to see a big movement in this marketplace, and we're probably 10 years behind most other marketplaces around the country, to more aggressive, either partially self-funded, fully self-funded, other types of funding arrangements, right? And so we would expect that to continue into next year. So we're going to kind of talk about a program through Aetna and then 3 or 4 other ideas that we see a lot of people starting to employ in this marketplace. So I've talked about the fully insured plans, but we can do health reimbursement accounts, health savings accounts, partially self-funded hybrid insurance programs. One thing that we're excited to roll out for this year. We hope that we would be standing here talking about association health plans and how we were going to combine everyone into one program. Got approved from a federal level, but from a state level, Department of Insurance stepped in, and that's not going to be allowed, at least for this year. But during those conversations that we were having with the carriers, we were able to get a 2% discount for Aetna programs through the Bar Association. So very excited about that. It's a product that you can access through other sources, but if you come through the Bar Association, we'll get a 2% better cost than you'd get anywhere else. And let me just tell you a little bit about that product. The product's called AFA. It's called Aetna's Funding Advantage. It is the only product that they're selling in the under 50 market. So they're no longer in kind of their traditional program. It's a limited self-funded product, and what that really means is that it's technically a self-funded program, but you basically pay it like a fully insured. So when you do self-funding, you kind of are buying multiple parts of insurance to protect yourself against large claims and protect yourself against a lot of claims, and you actually are paying claims as you kind of go along in a truly self-funded program. But in these partially self-funded programs, it has all of those components, but you as an employer are paying the maximum cost, right? You're paying the top. You could potentially get a refund on the program, but we really compare it against a fully insured program where you're paying the absolute, highest amount that you can pay, and you have all the protections of kind of what you would be in the traditional fully insured market. The reason Aetna is selling the programs, though, this way is that by putting it on a self-funded chassis, it allows them to underwrite the case. Right? So what does that mean? So it's only for employer groups with more than 5 lives. From 5 to 15 lives, right, or 5 to 14 enrolled. In order to get an underwritten quote from Aetna, you have to fill out individual medical questionnaires. So they're going to ask, what's going on? Undergoing cancer treatments, have high blood pressure, like any of those things. If you're a small group and someone answers yes to those, you're probably not going to get approved for the Aetna program. If you're over 15 lives, we just needed a dependent level census, right? So that's a census of all the employees and then all the dependents that are covered with their names, dates of birth, home zip codes, and gender. And we're able to get a underwriting quote. What we found with Aetna over the past year is that about a third of the cases, they're saving companies anywhere from 15 to 20%. Third of the cases, they're kind of ballpark with where Blue Cross and United are, and a third of the cases, they just flat out decline, right? So a different approach, and again, it's something that you can access not through My Benefit Advisor, but if you come through My Benefit Advisor and the Bar Association, that final underwritten quote, we get 2% off of that price. Any questions about that? So those are kind of the main carriers that we see in the 2 to 50 space, and even quite frankly 50 to 99. But outside of that, we just want to talk through a couple different concepts of where we see the insurance kind of going moving forward. So I kind of joked about United Healthcare introducing an HMO, right? I mean, there is no other product that's going to come down the road that's going to provide savings, right, from a network perspective that I can see in the horizon. The only thing that we really see are networks getting smaller and smaller and limited, kind of like that proactive. So we're constantly trying to find new and better ways to help employers save money in this marketplace. And I had mentioned real quickly on the page before that we're doing some things in the limited self-funding or HRAs. So this is an HRA concept that we've been selling for a couple of years, and it just really keeps picking up more and more steam each year. So essentially with an HRA is a health reimbursement account. It's an account that an employer sets up to help their employees offset some of the deductibles, right? It's a promise to pay. So what it is that, what do we have? Say 15 people in the room. So essentially, I as the employer would say, I'm gonna pay $1,000 of your deductible, all 15 employees, right? So in theory, I have a $15,000 liability. But in practice, just the people on the left-hand side of the room are actually gonna use it. People on the right-hand side of the room are gonna use either 0 or 500. So although I promised that I was gonna pay out $15,000, if employees don't use it, then I don't spend the money, right? And so depending on the actual final design, we see utilization anywhere from sometimes in the low as the 20s to maybe even as high as 75%, but certainly, a percentage of what it works. This is a real life example, a 19 life case. This particular plan had a $2,000 deductible on one program and $2,500 deductible on the other program. We moved this case to a $3,500 deductible plan, right? And so in moving it to a $3,500 deductible, we increased the liability to either participant or the employer, however you want to think about it. $1,500 for a single here, $3,000 for a family, $1,000 here for a single, $2,000 for a family. So we increased the liability, $32,000. The employer then said, I will pick up the cost of that HRA. I'll pay it for the employees. Okay. In doing that, we're able to lower the premium on the policy from $550,000 to $465,000. Right? So in premium savings alone, they saved $84,000. Right? So if 100% of the people use the additional deductible, they would save $50,000 on a 20 life case. Right? But we know that 100% of the people are not all going to hit their deductible, so their savings are somewhere between $51,000 and $84,000. This is something that is not carrier specific. You can do it with Blue Cross, you can do it with Aetna, you can do it with United, right? It's a different way to start to shift some of the risk away from the insurance company, and there's some risk that you would take on yourself as an employer, right? But then we find different mechanisms to be able to kind of do that, right? Another example, and this is similar concept, just a different program. We're always out there being, the representative of the association, trying to find unique things that you can only get through the association. So the 2% from Aetna, This is another one, company called a difference card, pretty limited distribution that we have access to. This takes that HRA concept one step further. So, and what I mean by that is that this is more, that prior example, we were only tweaking the deductible a little bit, right? This example is a little bit more extreme. Pretty rich benefits right now. This is the current plan benefit design as we're speaking. It's a 20 life case. They had pretty traditional Blue Cross programs, 20/40 on the doctor visits, 150 a day hospitalization, and a pretty generous benefits. And so, gated, non-gated. What we're able to do is actually move this plan to a different Blue Cross programs, but that had $3,300 deductible on this plan, $4,200 deductible on that plan, right? And that generated savings of 30%, almost $60,000. Right? It's not really savings of $60,000 when I just gave everyone a $3,000 deductible, right? I mean, listen, we can save money that way, but what we really wanted to do was find a way to keep their benefits pretty similar and kind of go from there. So what the difference card does is actually then uses this HRA concept, right, to rebuild the benefits back up to the level they were before. So in this particular example, it was important to the employer that their employees were going out and doing their primary care visits. So we basically said any primary care visits we're going to cover at 100%, zero copay. Specialist visits we're going to cover at $40 copay. And then pretty much matched all the other benefits up down the board, maybe made the prescription a little bit better. And in the long run, we expected that cost to be about $193,000, right? What's unique about this particular program though, is that unlike in the one before, where it was like the liabilities here and the employer was taking on all of this, we actually insure the amount that this employer would have to pay, right? So we actually buy insurance on the overall liability here so that we can guarantee that they would save $18,000. And if the utilization is better, which we expect it to be, the savings would only go up from there, right? And so we use this when there's a little bit more dollars at stake and we're making more dramatic changes as far as the deductibles are concerned. And the interesting part about this illustration, that I like is that, this to us, shows that over this time period, they're showing kind of a minimum 5-year savings on $160,000, right, on a 20 life case. And listen, we've all seen this for years, right? You can put a chart together that says anything. But what I like about this different part in this concept is that the assumptions that we're using here on both the renewal and on the revised premium are with the same carrier. So it's not like I'm not comparing apples and oranges, right? I'm saying if you stayed on your current Blue Cross plan, it's going to go up about 9% a year. If you move to this other Blue Cross plan, it's going to go up about 9% a year, right? So to me, it's a pretty close to a fair comparison, right? But just looking in the math, one of the things you see is that if my starting point is 211, that 9% a year compounded goes up about 90 grand. Right? But if I can lower your starting point to 152, that same 9% only goes up about 60 grand, right? So the lower you can get your starting point when we start compounding that, the better long-term results you're going to have in programs like this, right? And so that is certainly a concept that we're starting to see, and this is a real life example that we're looking at to do implement for this company December 1st. Okay. Last quick concept I just want to talk about is something that we're looking to build specifically more for the 500 to 200 employee segment, right? What did I say? 500 to 200. 50 to 200. Edit that. 50 to 200. It will go down to about 25 lives, but really I see it as kind of a larger group play. And that's the introduction of a captive concept. And so captives have been used in insurance for years and years, more on the property and casualty side. Large employers combining together to basically share the risk Specifically in the workers' comp space is where we used to see it, large manufacturing companies, things like that. But it's a concept that we're able to bring over to the employee benefits side. We particularly like the captive that we partnered with for one very specific reason, and that is that they have people already in this captive concept. So, prior years, there were a lot of people that were pitching captives in the association space. We would have to find 12 like-minded companies, 15 like-minded companies to get up to 1,000 lives and hope that they all join, right, to build it out ourselves. With this concept, if one wants to join, there's already 50, 60 companies and multiple different captives so that we have a place to kind of put that. And without going into excruciating detail, which I can, really what the concept behind this is that, listen, there's a lot of people going towards self-funding is the solution to all, right? And we just feel like if that's the direction you're going to go and you're going to get a little bit more aggressive about your claims management and things like that, we think the captive concept has a lot more stability to it because you're really spreading risk, not just with an insurance company, but you're spreading risk with, as I was saying, 40, 50, 60 different companies. And in using the captive concept, we kind of break it into a couple different things. So as a small employer, this is a 60-life case. So we're not talking about an enormous case. They have an expected cost of about $438,000, a maximum cost of about $521,000. Really what this breaks down is that we break this whole, the dollars that they're spending, we're going to go back to this for a second, into a couple different areas. They're going to spend about 10% of it on administrative fees. That pays us, it pays the people to pay claims, things like that. They're also going to pay a premium, which they call risk shifting, for the top end of about $60,000, right? And then they have variable costs somewhere in the area about $400,000. Real quick, how those variable costs work. The bottom, kind of dark blue is their claims cost. So this is an employer of that size paying their claims, right, as they come in. If they have better claims that year, they're going to pay less dollars out. If they have worse claims that year, they're going to buy protections to do two things. The protections are going to say that no matter what, this group can't pay out more than $257,000 of their own particular claims. And then the second thing it's going to do is it's going to say that no one claimant, not claim, right? No one claimant can go over $35,000, right? So that's the second thing that they're buying insurance for. So, and then what's unique about a captive to more traditional self-funded arrangements is that the captive, they're basically combining. So they're taking $133,000 of their insurance premium and combining it with 50 or 60 other companies. And they're insuring self-funding from $35,000 to $500,000 per claimant, right? And then they're paying $66,000, right, to insure everything over $500,000, right? So through this process, why we think that this is a better way to do self-funding is that whenever you look at a self-funded approach, you always look at, well, here's what we expect, but here's our worst case scenario. What's unique about the captive concept is that when you talk about the worst case scenario, you talk about this, we call it risk taking here, but about the claims of just your group is at $257,000, right? So you can win or lose in that area. But then when we talk about kind of that second stop loss area, that's where you're participating with all the other groups. So technically, you could have a very bad year from the risk taking perspective, like your particular claims, and you would cap out at that 257. But if the rest of the captive has a good year, no one doesn't have a lot of large claimants, right? You get a dividend on that premium. The average dividend on this program is about 9%. So kind of 9% of this $133,000, you're looking at $10,000, $15,000 getting returned to you because of the nature of the rest of the group participating. So, again, very unique groups that this kind of fits into. We think it's a great fit for that 50 to 200 space. Again, a little more aggressive group, maybe we would go down to 25, but certainly something that, as I said, constantly looking out there to try and find different and unique programs, and this is something that we see getting a lot of traction here in the next couple of years. right? Last thing, just on the consulting side, kind of talked the story about, USI, but then also on the My Benefit Advisor. We worked with the Montgomery Bar for a number of years. We've also worked with most other counties in the area, plus the state in both New York, New Jersey, Pennsylvania. We have a ton of experience in attorneys, right? So we have a ton of law firm experience, but we also tap into some of our national resources. So we're able to truly benchmark, right? There's a lot of people that can pull benchmarking from Kaiser and different groups, right, that will tell you all what 30,000 life companies are doing. This is actually bringing it down. And so we give you real answers on what are contributions for professional firms in the Mid-Atlantic region, right? So just to give you an idea, this is what our benchmarking tells us, but the average contribution, because this is what everyone asks me all the time after we figure out what the plan is that most employers in the professional space are charging their employees around $143 or 24% of the premium on a monthly basis. Right? For families, they're charging them about $600 or about a third of the premium. Right? To me, because this does capture in larger cases in the 100 to 200 space and actually captures in Baltimore, DC, Philly region, that I think that our region is probably slightly lower than this as far as what contributions are being passed on to employees, specifically in the under 100 and under 50 space. We tend to see that employer contributions more in the 80% range, 80 to 85, with employee contributions in that 15 to 20. Although we do see a bigger shift away from family contributions, significantly. We had a lot of people talk about it in 16 and 17. A lot of firms make significant changes in 18 because if 15% increases when maybe you were budgeting 9, 10, right? You had to find the money from somewhere. And where we're seeing people kind of make that shift is, and quite frankly, this is our recommendation, is not to take the money away from the singles, from the employees, but rather you see the shift often coming from the dependents, right? So again, not across the board, something that we work with, but it's nice to have solid data points behind this to say, not only is this my and Ray's personal experience, but here's what we see kind of across our book of business. So we can show it to you in charts as well. Other thing that just on the consulting side, we're actually having a seminar about this in a couple days here. We've made a significant investment in our Medicare department. Kind of from twofold reasons. One is, obviously, baby boomers, more and more of them turning 65 every day, so there's a retail opportunity there. But secondarily, it's becoming a huge issue for our employers, right? Whether you're above 20, below 20, should they be on Medicare, should they be on the group plan? Do they have to be on Medicare? They have to be on the group plan, right? It all depends. And, Medicare, frankly, it actually runs pretty well when you set it up properly. A little confusing to get up there, but we find that most employees, when they're educated on the process, would rather be on Medicare than be on the group plan, right? And if we can get them on Medicare for, $350 or $400 a month versus keeping them on the group plan, in some cases it's $600 or $700 a month, right? It's real money, $3,000 or $4,000 in savings by moving people to Medicare. That's the right decision. Exclusive programs also through the Bar Association, dental and vision products through MetLife and actually United Concordia. The MetLife program, about 10,000 members across all of our associations that are in here. So a terrific program that you can only get access to through the Bar Association. So there are plans, our prices. For those of you that are already on this program, we have 3 dental products that we're selling right now through MetLife. We happen to call them silver, gold, and platinum. The silver and the gold have a no change in rates for 2019. The platinum plan, which has a $3,000 max and ortho and is really, really a very, very rich program, is getting a 6% increase. All right, so it does work when we have a chance to combine all of those bodies to purchase the insurance. This is another quick thing. I'm going to turn it over to Ray in a second here, but if you want copies of the presentation, just give us your card and we'll be happy to shoot it out there.
So when we talk about our consulting, we talk about the prices and the premiums that you pay, and long-term plans, and doing things a little bit differently than some of the other brokers. Where we really find, in addition to that, where we come in and really offer your firms something greater is with our benefits management. So we start out giving everybody a employee benefit audit. That audit, which takes probably less than an hour, goes through all of your benefits, your plan documents, your compliance, everything that is related. Because when you talk about it, it's just not your Blue Cross or your Aetna or what your rates are and how many employees you have on there. We look at your contributions. We look at the benchmarking, which Brian had there in previous places. And then we put together a service calendar. This is just a sample. It's an interactive guide between your firm and your administration, whoever's running it, and ourselves. So we put everything on here that we need to do during the course of the year. Many firms look at it and say, hey, we only talk to our broker once a year, and if we have a problem, we call that person. With us, we're engaged throughout the process. On the earlier slide, you saw about the account management team. So the account management team as your account manager. You also have your account consultant, excuse me. That account consultant is in the office all the time. The account manager's out meeting with firms like yourself, making sure that everything's taken care of. And then the customer service department behind that. So we'll meet with you 4 times a year. And in 4 times a year, we're going through each part of the process. After the renewal, we're saying, the renewal's over. What should we be doing this year? What are we going to do? We're going to put in a new online system for you. Are we going to change some of your policies and procedures? And that's where we start the plan, is right after the renewal. Then as we get towards the second quarter, we're starting to talk about trends and new things in the marketplace. And really in the middle of the year, what we're doing is we're starting months out exactly what's happening in the marketplace. We know what your increases are going to be. And so we're putting that through this process. And in many cases, we're getting our renewals done 2 to 3 months prior. You're not getting them done, you're not getting your renewal, and then a couple days later or a month later or whatever, you're talking to your broker and you're just getting your renewal at the beginning of December for January 1st. It's all part of this process. In addition to that, we're working on your compliance, we're analyzing your plan documents, we're making sure that your summary plan descriptions, everything that you need to stay in compliance is working throughout the year. Right now, we're making sure that all of our clients are getting their Medicare notices out to the employees. So CMS, Center for Medicare Services, says that by October 15th, you have to alert everybody on your plan of what your prescription is at least as good as the Medicare D benefits. And that notice has to be out to your employees by October 15th. Our account management team is pretty much finishing that out for all our clients right now. So those are some of the things, but this calendar is our report card to you that we're working on everything throughout the year and that we're not missing anything. Our claims and healthcare advocacy. So we are the largest broker for Aetna and Blue Cross in this area in southeastern Pennsylvania, and we're the largest Blue Cross broker in the state of Pennsylvania. When you have a problem, we get answers. When you come to us, we go directly to high-level senior people at Blue Cross. We're not calling into the 800 number that you would be calling into, or that some of the smaller brokers are calling into. We're working to get claims taken care of. One of the examples I usually give, because it still, touches you deep inside, is that one Friday afternoon in the summer when you think no one's working, I got a call from somebody from one of the Montgomery Bar Association firms, and the administrator said, we have a problem. I said, okay. So tell me about it. So I actually pulled into, there was a YMCA right there. I pulled into the YMCA right at 611, the Abington Y right there. I don't live too far from there. And they had an attorney who was on vacation. They had a problem with a child, 3-year-old child, with something with their brain, and the hospital wanted to put this child into surgery immediately. And Blue Cross said, no, we're not going to do that. Get them home, we'll figure it out. The doctor told the parents, If this kid doesn't get operated on today, there's gonna be an issue. I called my office, got our head of claims on the phone. We got the head of claims on the phone with IBC, and that child was in the surgery within 2 hours. I mean, it's, that's a great story. It's not always that way, but we do push until we get answers for our clients. You're at the pharmacy and you have a problem with the pharmacy. You call into our customer service department. Again, we have a staff there waiting for your phone calls, and we'll get the pharmacist on the phone, we'll get Blue Cross on the phone, or Aetna or Cigna, or whoever the carrier is, and if we have to, we'll call the doctor's office at the same time so we can get those pre-certs and different things taken care of that you might not be able to get done. And you might leave a pharmacy on Friday without medicine because you don't think you're going to get an answer till Monday. But that's what our customer service is there for. With much larger diagnoses, we use an outsourced company called Guardian Nurses. Guardian Nurses has been on a lot of news channels in this area, and they take care of anything that's very clinical and try to get help for our clients. This next section is newer to us, newer to our clients. It's an HR product called Think HR. So Think HR has 3 levels. This first one is called Think HR Comply. It's a database that you and your administration can go into at any time. It has compensation tools, job description builders, compliance guide and checklist. Any question that you want answered, that you might just want to look up what it is for anything in HR, you can go into this database and get answers for that. But more exciting, we just added this September 1st, is Think HR Live and Think HR Learn. So Think HR Learn is over 200 online courses that you as an employer can take, such as active shooting. What happens if something happens in our workforce? Do we have a policy for that? If something were to happen, what do we do? You can go through programs such as that for yourselves as employers, but there's also employee training modules, customer service. If somebody calls into our office and has a problem, how do we deal with it? So again, over 200 courses. You can print out a certificate. We have some people that are sending a bunch of these out, and the more that employees get, the more incentive the employer is giving them to take these courses and print those certificates out. Think HR Live is great. It's a hotline of a team of HR advisors that are all SHRM certified, Society of Human Resources Management. So they're there to answer any human resources question. I have an employee coming in late every day. How do I handle this? I'm thinking about terminating somebody, but they're at the age where we might have a discrimination problem. Those are the type of things that you can get answers. Now, people say to us, hey, we have an HR person, but your HR person may be doing payroll, they may be doing other projects, they may be fixing the bathroom because the lights aren't working right. There's so many things that in a small firm that you're handling on a one-on-one basis that this is just it's an extra resource for you. And this is available to all our clients as well. Form 5500, this is really for larger firms. So in a firm under 100, the only thing you're filing a 5500 for is your retirement plan at this point. But in the year 2020, which we're almost in 2019, the Department of Labor is going to require that everybody files a 5500 for all your health and welfare benefits. Meaning that if you have 10 people on your insurance program, you're going to need to file a 5500. It's a service of ours that's included. We give them to you signature ready, you approve them, we send them off for you to the Department of Labor. COBRA administration. So COBRA administration, if you have a small firm, there's a mini COBRA in Pennsylvania. If you have a large firm, you have a regular COBRA program. Part of our process is that you send us the addition of an employee. We put them into the insurance company systems. So let's just say you have medical, dental, vision, and maybe life insurance. We make sure that they're enrolled in everything, and we get them their initial rights COBRA notices. When they're terminated, you send us an email. We terminate them in each of the systems, and we get the COBRA paperwork started. Again, this is something that's included at no additional cost. This is a case study. We're not going to go through those because it's, we're rushing on time. But we can talk about these, and we are going to send the presentation out to everyone. But we show a net savings of $19,000. The financial impact was $19,000 by us getting involved in a claim where an employee there was an error at a hospital, and when they saw their bill, they were going to pay it, and somebody at the office said, "Don't pay that until you talk to these guys," and we were able to get a savings there. So as far as enrollment for your employees, many of you may be using paper enrollment, just handing out applications. We have an online enrollment system, and that online enrollment system, I kind of skipped around, but the online enrollment system will allow them to go in, make changes to their plan. For instance, if they need to change an address or add a dependent child because they just had a baby, they can do that type of thing in the system. And it goes right to us. We make the changes in the system, in the carrier system, and it's a good way to just keep track, make sure your bills online every month are correct, and have a way for you to stop doing paper for everything. In addition to that, we have the benefits guidebook. The benefits guidebook is about a 20 to 25 page document which you can hand out to new employees. We use them at the open enrollment meetings. It has all your required Department of Labor notices in the back of it, but in the front it's all of your benefits. You can put contributions, you can put information on PTO, anything that you want on your firm, we'll put in this guidebook for you. And they're nice to hand out because it's not just handing a Blue Cross sheet and then the dental sheet. It's all comprised into one document where we'll put your colors, your logo on there, make it look real clear, and the last page is everything about our customer service department and what we're doing for those employees, so that when they have a problem, they know to call us and not come to you with all the HIPAA violations. For larger firms, usually over 25, we can also do a benefits video. Both the guide and the video are great for when you're trying to hire a new employee or a new attorney and they want to know what the benefits are. They're also good because we know that attorneys don't go home and tell their spouse what the benefits are. Now they have something they can actually give them. More on the online enrollment. We're offering discounts through 3 different payroll companies. Last week, we were able to save a firm in Philadelphia 25% on their payroll costs. They were using paychecks. They really weren't happy. They said, "Who do you use?" They gave them a couple options. They wound up going with ADP. ADP and USI on a national basis have a relationship, and it's not just payroll. They have many other products, but we saved that law firm 25% on their payroll costs of the products that they were using. The call center is there Monday to Friday. At night, you can email us. We'll get back to you the next morning. If many people sitting around the house and then you think of something, you can leave us a voicemail or you can send an email. But we'll help you with anything: claims, information on your plan, how things work. I'm thinking about having surgery. Where do you think what type of doctor I should use, or something like that? Those are the things that are great for our call center. And another case study here. So compliance has become big since the ACA has started in 2010. With compliance, every firm, whether you have one employee or you have thousands of employees, have ERISA guidelines that you must follow. If you have a flexible spending account, that should be audited every year for making sure that you're non-discrimination against the lower paid employees. So those are things that we're doing. We do a compliance audit annually for you. We update plan guidelines and plan documents, making sure that if the DOL comes knocking on the door, that you're not going to have any problems. And since the ACA has been in place, there more and more over the past few years, there's been DOL audits because of they need to find ways to pay for their programs. The compliance assistance, this is the 17. It's a little dated, but we're every time that something changes, we send it out to you. One of the most recent ones is on health savings accounts. The health savings account, new regulations have passed through the House. They're now in the Senate, where they may increase health savings accounts up to the out-of-pocket maximum. Those are things we're using on the planning side for you, for help you as either for the employees or for the attorneys for tax savings, and many other things. As soon as something changes, we're getting that out to you. This page here it's just a checklist. It just shows what we work on. I mean, it's only a portion, majority of what we do, but there's several other things that we can help you with. And, are you getting these services from your broker now? We could put a financial savings next to each one of these to show you, okay, well, you're getting the HR services and the online enrollment system. And we can show you what the savings is. But basically, this compares us to anyone else. That's pretty much it. Questions?
So we're going to stick around for as long as people do have questions. If we could indulge you for just a couple more minutes, just for the other parts of USI, to just give you a quick overview on both the individual benefits and the professional liability. So with that, I'm just going to turn it over to India real quick to talk about individual benefits.
Okay. You guys hear me good? So my name is India Williamson. I am the director of the Individual Benefits Department. I take care of, or I should say our team takes care of life insurance, disability, long-term care, business overhead expense, key person insurance, and buy-sell agreements. Okay? So just to go into each one a little bit more, for life insurance, I told you we actually are the brokers for the association. So we have a direct contact to all the top carriers that are A-rated and higher, okay? Through the association, you actually get a discount from New York Life, which is a great and reputable company, okay, for the life insurance. We're directly connected to the underwriter, so therefore if a person has a specific ailment that is a little bit unorthodox, we can actually talk to the underwriters directly to make sure that that is perfectly rated. For example, we actually had a client that not to be a little personal, but she was on a medication that it seemed like a lot of people take it for if they have diabetes, but she actually was taking it for a completely different reason. She would have been highly rated if we didn't have that information and provide that to the directly to the carrier. Okay? Same thing for disability insurance. We have a direct, obviously. Association with that carrier, which is New York Life, and all the top rated ones. So if it wasn't qualified for that carrier, we can go to the other carriers and shop it around. Disability insurance is so important. A lot of people think of it as just used for accidents, but of course we all know how stressful your jobs are. So sometimes if a person has an ailment when it comes to mentally, they make sure that that's protected through disability insurance. Okay. With our long-term care, we make sure that inflation protection is also important and can be protected through the policy that we have with our carriers. Through the Bar Association, we also provide you with, like I said, the key person insurance, which is also good for managing partners and the HR personnel. For those people that also are bringing in a large amount of the revenue that is for the firm, God forbid something was to happen to them, I'm sure it will be a huge financial blow to the firm. So we want to make sure that that is protected for you as well. It's very important. I also want to point out to you guys with buy-sell agreements. A lot of partners are like, yes, we understand the importance of it. It's in the back of their minds, but they don't take care of it. Until something happens, something is wrong, and either that person, which is the managing partner, either gets sick, or one of the partners unfortunately died, and now they're in business with their spouse, and it's too late. So we want to make sure that's prevented for you. We've been around for eons of years, and we want to make sure that you understand who we are and that we are that one-stop shop for you for the health insurance, all the personalized insurance, and also malpractice, which is what Brian's going to talk about a little bit. So, thank you all. If you have any questions, I have some handouts as well and my cards. So, thank you.
Yeah, and we would just be remiss if we didn't just touch base on kind of the other area of expertise within USI and what you guys probably know us best for, which is the lawyer's professional liability. I'm a benefits guy, so our professional liability person had a family emergency, so we stepped away. But we do have some information up here. You know, it is a very, very strong form as far as professional liability is concerned. Really the strongest in the state, and I sit in these meetings all the time. You know, CNA has a terrific program. If you haven't looked at the program recently, it probably makes a lot of sense to come back and revisit it. They're constantly working on the program, the pricing, and you know, much like we talked about on the benefit side, we work with attorney firms throughout the tri-state area, so a lot of just internal experience to be able to benchmark and make sure that the program that you have in place is the right for your particular firm. So, you know, when you're looking at your professional liability the next time, if you're not a part of the Bar Association program, you can only access the CNA form through the Bar Association. Please, you know, take a look at that. If you are a member and you purchase the insurance, you can get up to a 5% discount per attorney. And if you also go through the CLE and risk management programs, you can get another 7.5% discount. So, you know, significant discounts that you can access by going through the Bar Association program. All right. With that, I'm just going to thank everyone. I think we're like right on the dot at 1 o'clock. So we really appreciate everyone's time. There's some information up here about the individual. If you want us to email you out the My Benefit Advisor presentation, just give us your card. And if there's anything we can do to help, you know, please ask us or give us a call. You can always contact us through the Bar Association website, or you know, we'll give you our contact information. All right, thank you.